Welcome to One Big Boat. We're all in this together. A show focused on people and organizations whose work is making a true difference in people's lives. Today, we welcome Deborah Youngblood, the CEO of Mother's Milk Bank Northeast.
A lot of times you learn about it in the hospital when your baby needs donor milk.
She's on board to talk about the critical role donated breast milk plays in the survival of some premature newborns. That's next on One Big Boat. We're all in this together. So we have a lot of nonprofits come on here, and usually we know them. I didn't know this one, but then I didn't feel too bad when I was looking through your media, and some of the mothers that donate didn't even know about this. Like, how did it start, I guess, like for you? How do you get involved in this?
Yeah, absolutely. So, I mean, I think you're pointing to a really important point about milk banking in general, which is that it's under the radar, right? It's just not well known. And it's one of the things that we're always trying to fight against, because I think when people do think about milk banks, they think, what a nice thing. But actually, milk banks are providing a required medical resource for premature babies who can only safely have human milk when they're born. And if they don't have a maternal supply, there has to be another safe supply. So milk banking has been around for 100 years, but our milk bank has been around for about 20. And it was really founded in 2006 to meet to fill a sort of gap in the New England medical community. We were at the time getting our donor milk from Ohio, and our founder, Naomi Bar-Yam, realized that, we could do better. We're here in Boston where, we provide incredible healthcare and innovation around healthcare. And so she founded the milk bank at her kitchen table. And we've grown leaps and bounds since then.
How do women mainly find out about it?
Yeah. So women find out about it and families find out about it primarily two ways. A lot of times you learn about it in the hospital when your baby needs donor milk. And so unfortunately, that's often the first time that families are hearing about donor milk. And that's something that we really want to fight against, because if a doctor or a nurse is telling you that your baby requires donor milk, it means something's not going as planned. Sometimes it's that you wanted to breastfeed and you need to supplement because your own milk's not in, and that can be upsetting. But sometimes it's because it's more of a medical crisis, and your baby was born very early and very low birth weight and is receiving NICU care. And for those babies, donor milk is the gold standard of care. So almost every NICU in the country has donor milk to serve those babies to protect against life-threatening conditions. And so those families are told, we recommend donor milk until your own milk comes in, if it does.
And how do you get donors? Because that was the thing that I read one story on your website, and there was a woman who had a little boy, and he only lived for 17 days because he was born so small. He was born about a pound, 1.1 pounds.
Yeah.
And she then turned that into an opportunity to give her breast milk.
Right.
So luckily, not all of it has a tragic twist to it.
Right. Yeah, we do have a bereaved family program that Maya was part of in honor of her son, Teddy. Yes, families hear about milk donation a couple different ways. So there's a group of families that needed donor milk, and they often become some of our most dedicated donors down the line. They really recognize the impact that receiving donor milk had for their baby and their baby's ability to grow and thrive and kind of start meeting those milestones. And so when their own milk comes in, they will work hard often to be able to donate and give back. Then there's a small segment of the population who is just what we call overproducers. So they're nursing their babies. They have more milk than their own baby needs. And what any mom will tell you is that pumping milk is hard. It's hard work. And that milk is really precious and they don't want it to go to waste. So they become what I like to affectionately call our accidental milk donors. They sort of look in the freezer and they're like, oh my heavens, I have more milk than my baby could possibly need. I want to do some good with it. And they go out in the world and they go looking for us. Where could I donate this milk? And so then they find us. Sometimes a lactation consultant sends them to us, sometimes pediatrician. Medical professionals know a lot about milk banks. The general population, a little bit less so. And then they reach out to us. Donors have to reach out to us. We can't go recruiting donors. We're a public health organization. So we want to be sure that a biological baby always gets fed first, and that there's never an incentive, a financial incentive or any other kind of incentive that somebody would provide their milk to a milk bank or anywhere else before their own baby gets fed.
How big is your network? Because that surprised me.
Yeah. So, this year so far, we've got 1,400 active milk donors. So it's a pretty, it's a small slice of the population that can donate. But those that we've been able to kind of work with and get to know and explain the impact of their gift of milk, they become very dedicated. And so, we're very fortunate to have that. It means we've been able to keep up with really growing demand for donor milk.
And every time I think of milk, I think of use by date kind of thing on the carton.
Yes.
You know what I mean?
Yes.
So what's your use by date when somebody donates?
Yeah. So donor milk, as long as it's been frozen, can be used for up to a year. So, what is going to happen is an individual family, they're going to have frozen their supplies. Then when they reached out to us, we're going to do a health screening with them. It's a lot like a blood donation. We're going to do a health screening with them. They're actually going to do a blood test to make sure that they don't have any infectious diseases that they're not aware of that could be passed through the milk. And then once they've sort of been safely screened, they're going to send us that frozen milk. Our milk bank is full of chest freezers and a walk-in, and we are just, sort of a cold storage facility. And we keep very careful track of those dates. And then we're going to mix donor's milk together after we thaw it, and we're going to pasteurize it. We're going to make sure that there's no bacteria in it through another screening test post-pasteurization. And it's only then that we're going to then distribute that milk. Hospitals then go through it very, very quickly. And the vast majority of our milk goes to neonatal intensive care units in hospitals. So, we're going to get a lot of them, the larger ones that have a lot of births, they're ordering every single week. So once it gets to them, there's no sort of like, oh no, it's going to expire in the freezer. Like, it goes to babies right away.
Coming up,
so there's a few different ways that people get us the milk.
how eligible donors can help out. The donation versus the need. Mm-hmm. Are you keeping up with it?
Yes. So We do a triaging of donor milk. So first and foremost, our mission is to serve the most medically fragile babies. Those are the babies that may not survive to their first birthday if they have anything other than human milk. And so that demand, we've never faltered on. A NICU says we need X number of bottles of donor milk this week, 200, 300, and we say, of course. So that's our first mission. Then we also increasingly see growing demand in the healthy full-term babies. So those babies that everything went swimmingly, they were born at a nice healthy weight. And then the family wants to breastfeed, but they need a little supplementation at the beginning. A lot of times people need a little help at the beginning. And so that demand, we've also been doing a really good job of keeping up with. Sometimes families at home also need a little bit of help. We call that bridge milk. So they just need a couple weeks of milk to support breastfeeding goals. And those have huge, huge outcomes in terms of the health benefits if we can successfully help a family on their way to a breastfeeding journey that they want. And so, the outpatient demand, that's where if we could reach more milk donors, we would be able to serve more families and have that big return on investment in terms of supporting breastfeeding. Most of the time, we can give people a couple weeks worth of milk to get them over that hump, but not always.
How do people get you? Do they have to go donating blood? How do they get you the milk?
Yeah. So there's a few different ways that people get us the milk. If they live near our facility, which is in Newton outside of Boston, they can bring it in. We're always excited about that. It gives us the chance to meet the milk donor themselves and to often meet their baby and that sort of thing. So it reminds us why we're there. We also have throughout our region, so we're in 11 states, we also have sprinkled throughout our region community partners, and they offer things that we call milk depots. So it's a community location, and if people live near that community location, they can actually drop their milk off at that depot, and then the depot ships the milk to us. And then the most common way that people do it is we send them a box and all the shipping supplies. We're going to pay for everything and tell them how to pack it, and then they're going to overnight ship it to us. It gets picked up from their house and overnight shipped to us so that it stays frozen.
You're a nonprofit, but you're charging the hospitals. Mm-hmm. So you obviously don't need to raise any kind of money.
Of course not. We're rolling in riches. No, we do charge some processing fees to cover the costs, of course, of all of the expertise that we need, the clinical expertise that we need for health screenings, the pasteurization, the testing. But then we also need additional financial support. We have what we call the Compassion Fund. That is a way for us to ensure equitable access to donor milk so that for a family who's lower resourced, that they can access donor milk to support them. We also have some special programs for families where there's been a maternal loss and that the surviving parent wants to have donor milk for their baby, or where there's been a maternal experience of cancer where they also are unable to breastfeed, but they would like to have some donor milk. So we have these programs that we're always looking for philanthropic support for.
Somebody might be watching this and say, well, why not just give formula? I didn't breastfeed. I just gave formula. Why not?
Sure. Yeah. No, it's a good question. And, we're not against formula at the milk bank. We know that formula has an important place in infant nutrition, and we want parents to make the decisions that they feel are best for their children. Donor milk isn't here to replace formula everywhere. Donor milk is here for very low birth weight, very early babies. Now that rate of premature babies is going up. It's been going up for the last 2 decades. So 1 out of every 10 babies is born early. And the babies that are born very early and very small, they have immature digestive systems. And those digestive systems can only safely have human milk. At the same time, it's kind of a perfect storm because when a baby comes very early, a lot of time mom's body wasn't expecting to produce milk yet. And so she doesn't. And so we have to have a safe source to fill that gap. Babies that receive donor milk instead of formula at that stage, those very early babies, it reduces their risks of this kind of rare but very complicated disease of necrotizing enterocolitis. And that can be fatal. It's actually the most common cause of deaths of premature babies after 2 weeks of age. So that's why every neonatologist is familiar with donor milk, and they know that they need it in the NICU. So those are the babies that we're there first and foremost for. For the healthier, the full-term babies, for a family that wants to breastfeed, there are huge, huge health benefits that are well documented, clinically supported from breastfeeding. Human milk is kind of called liquid gold for a reason. And we want to be sure that we're there to support those families in achieving that outcome if that's what they want. So donor milk is a great bridge to a family's own breastfeeding goals. If that's not their goal, then donor milk's not needed. But if it is, that can be a really big support. And babies that are breastfed have really big benefits. It reduces a lot of risks of things like allergies, certain cancers. And then for moms, it's got huge benefits as well.
When a couple finds out that they're going to have a baby, they are told so many different things. They go to classes. Why isn't this being discussed during that process?
You know, it's a great question. It's something that we are really wanting to try to change. You know, I have conversations all the time where I'm meeting with families. There's a dad that we worked with whose baby needed donor milk. Baby was in the NICU. And, you know, he said to me, like, my wife, Lauren, and I, we took every class imaginable. We knew everything about what it was going to mean when our son was born and what we were going to need. And not a single person mentioned donor milk until Jack was being whisked off to the NICU. His wife was going into surgery, and I was being asked, do you want to feed him donor milk or formula? And I said, donor milk? What's donor milk? Like, I don't even know what that means. Donated by who? And, you know, so he was like, that just wasn't the time for me to be learning about it for the first time. I needed to learn about it in advance. You know, as a small nonprofit, we're trying to get the word out. We thank you for bringing us onto the show to help with that. And I think, but we need prenatal educators to be helping us spread the word, and all of the folks that teach breastfeeding classes and those kinds of things to help as well.
Yeah. If you want to donate, how do you do that?
So you reach out to us, have an initial conversation with one of our donor screening and engagement staff. They're going to ask questions about how much milk that you have, things about your health, and what you know, why you want to donate, and then if it looks like it's a good fit, then they're going to do a much longer conversation with you and do a full health screening and set you up for a blood test. We're going to pay for all of those things and help you get your milk on your way.
Yeah. What else should people know?
So I think people should know that when you donate to an accredited nonprofit milk bank, you know, we're just here for one reason, right? We exist, I like to say, because babies need us to exist. We're not here because we're making the big bucks and it's, you know, a profit. We're really here to make sure that babies have every advantage, that they have what they need to grow and thrive, that our hospitals can count on us. And there are other good things that people can do in the world if they have extra milk, but there's only one way that hospitals can receive donor milk. And it has to come through an accredited source. It has to come through a source where there's been that kind of testing, and so that they know that it's safe and that they can trust it. So we really want people to know that there's a special meaning to the gift that when you give to a nonprofit milk bank, whether you give financial funds or whether you're fortunate enough to be somebody who can give milk. And that we're here to make sure that more babies make it to their first birthdays.
Well, thank you. I really appreciate your time.
Thank you. I appreciate you.
One Big Boat is a production of Last Minute Productions Incorporated. This episode was produced by me, Jay Dobeck. Ethan Gallo is the sound engineer. Jim Johnson and Ryan Macheski provided production support. Joanne Pilata is the production coordinator.